So we had an episode. We talked about some challenging situations in caring for patients with diabetes. So first off, older adults. Paul, is there a framework that might help us to kind of approach these cases?
Faithful listeners who may have heard other episodes know we've been talking about the 4Ms or the 5Ms framework. In diabetes specifically, the 4Ms would be mentation. So assessing, can the patient assess or respond to their own hypoglycemia? Do they have awareness, and can they get to glucose tabs in time and sort of correct the issue should we actually precipitate it? The second M is for medications. So reconciling their medications, revising their medications. I think a lot of these patients are often on autopilot, especially as you see the A1C sort of slowly trend down. Is it time to back off that insulin? Is it time to stop that sulfonylurea? And the answer might be yes in many cases. There's mobility, which in the framework of diabetes, specifically looking for like diabetic foot complications, Matt. So assessing for neuropathy and managing that appropriately, making sure that, orthotics are used and appropriate, assessing their fall risk. And then what matters most in terms of discussing what the patient's long-term goals are, they're not all the same. And some are very sick and very complicated, and some are in the prime of their life. And I think you would treat their diabetes a little bit differently depending on what their goals are and how they're doing. And the bonus M, or the fifth M that we talked about, is the multi-complexity. So very rarely in older patients do you see diabetes in isolation. So what other things are going on that might complicate their care that we need to be mindful of? And that kind of framework, the 4 or 5 M's, is helpful for almost any disease state or any sort of geriatric consideration that you're thinking about.